Good morning and afternoon, everybody. I'd like to elbow bump everyone and welcome to our program this morning, The Responsibilities of Nonprofit Employers in the Age of COVID-19. I do have a slide up right now for everybody on the webcast who can't hear me because they're looking for a dial-in number. So we don't have a dial-in number, so I'm putting the slide up for folks who can't hear me, so hopefully to avoid some questions. My name is Max Smith. I'm the Communications Director for 501c Services. As you all know, we're a 100% employee-owned company that provides alternatives to state-run unemployment insurance programs and other mission-friendly services to more than 2,500 nonprofits nationally. Many of you on today's webcast are already working with us. Thank you very much for doing so. As you can imagine, we've been rather busy this year, but that's why we're here, and we're looking forward to continuing to work with each and every one of you in the coming days. Before I introduce our panel this morning, we have a special guest, Dr. Luke Sternt from the Oregon Health Services University. Luke, as you can imagine, is very busy these days, but he's graciously carved out enough time this morning to give us a little bit of a quick update. Luke, how are you doing this morning?
Yeah, good. So I'll just very briefly summarize what I assume is going to be the most relevant to you guys for the discussion going forward. So probably from the lay press, people have a pretty good idea about in general what this disease is. But I think that there's a couple of things that may have not come out in the popular press quite as clearly that would be important to emphasize. So, a lot of your employees are going to be folks who are maybe a little bit on the younger side, and so there may be some thought that they're not quite as much at risk because some of the early data out of China suggested that the COVID-19 disease caused by SARS-CoV-2 mostly was just affecting elderly people. And it is true that there is a worsening morbidity and mortality that's clearly linearly associated with age. But the data that's starting to come out of both Europe and the United States suggests that younger people are a bit more at risk than we saw in the early Chinese data. There was an MMWR from looking at the first 4,000 or so U.S. cases that got published in the last week that actually showed that about 30% of the total diagnosed cases, 20% of the hospitalizations, and a little over 10% of the ICU admissions in the United States have been in people between the ages of 20 and 45. So I think that that's a relevant point to think about when we're thinking about our workforce. The other thing that I think is relevant when we're thinking about your employees is that while transmission of the disease is basically similar to the common cold, it's mostly kind of direct contact with shared surfaces, and then your hands touching your mouth, your face, your eyes, that sort of thing. And so the density within which people are working is a really important factor in transmission, and the more shared workspaces and direct interpersonal interactions that are happening, the increased likelihood of transmission. There is probably some very small ability for this to be spread in kind of an airborne and droplet route, which is why social distancing and this idea of staying 5 to 6 feet away from people as much as possible is what's recommended, and why the most states and municipalities have gone fairly strongly towards this idea of social distancing in order to try to flatten the curve of the disease. And just to make the flattening the curve thing very transparent about why it's a big deal, if you look at states that have been able to do this a bit more effectively, and I'm going to use as a contrast the state that I'm from, originally Oklahoma, and the state that I live in now in Oregon. And Oregon was much more aggressive early about social distancing and flattening the curve. And as a result of that, our projections for the disease in the state have changed quite a bit, where our peak of the disease is now estimated to be in early May 6th currently. and we are no longer estimated to exceed our statewide either hospital bed or ICU bed capacity. Oklahoma, which was much less aggressive around early social distancing at a state and municipality level, has their peak estimated to be April 22nd. So a couple weeks earlier, it's estimated to be much higher. And at peak, it's estimated to, by over 250 beds in the ICU, exceed ICU capacity for the state. So the burden that doing this well versus not well, that it places on the healthcare system and the ability of the healthcare system to provide adequate care for the people that are sick and need it for this disease, is a really big deal. And so to kind of summarize why I think this is important for you all, when you're thinking about the decisions your businesses are making around their workforce, I think trying as much as possible to keep people out of shared workspaces, trying to let people work from home, and trying to really aggressively social distance as much as possible is huge. And because in the United States, at least, our healthcare system ties health insurance very closely to employment, and because one of the things that we're going to, I think, encounter, you guys have probably seen the numbers that came out yesterday about the number of unemployment filings skyrocketing in the last couple of weeks. I think 6.6 million or something like that in the last week. There's potentially a second wave of problems for the healthcare system that are associated with disease that come after the acute infections from the pandemic have run through, around just a vast swath of people being unemployed and or uninsured because of that. And so, thinking about the missions of your various organizations, any way that we can keep people employed and insured is both really important to be able to provide their care right now for people who are getting infected with COVID, but is also going to be hugely important for the healthcare system being able to manage the more kind of run-of-the-mill healthcare stuff that comes up over the next year. And so I think that that's just a really important framing thing to have in mind as you go forward in the discussion the rest of the hour.
All right, beautiful. Thank you, sir. I appreciate you giving us a little bit of an update this morning, and I hope you have a successful day, and we all appreciate all the work you and your colleagues are doing.
Certainly. And Mac, if there's follow-up questions about anything that I said, you have my email, and I'm happy to have you connect me to individual people if that is helpful going forward.
Perfect. We will do so. Thank you so much, Luke.
All right. Take care.
All right. Bye-bye. Bye. All right. Well, we appreciate Luke being here this morning, and we're going to go on with the rest of our program. I'll go ahead and cover some housekeeping real quick, and then we will hand it off to our panel. If you have any questions, please feel free to put them into the question box of the GoToMeeting platform. We do have a large audience. We do have a lot to cover. I cannot guarantee we will get to everybody's questions. We will try to shoot some to the panelists for follow-up, but just please be patient with us. Today's program, of course, is worth HRCI or SHRM credit for our HR professionals. You all know the drill. You will get a survey. It will pop up after we're done, and it will also be attached to the post-event email that goes out about 60 minutes once we're done. Please fill out the survey, tell me which credit you want, and we will shoot that to you as soon as possible. Again, it might be a little bit longer than what I usually do because of the size of the audience. Today's materials, everybody is going to get a copy of the recording, and everybody's going to get a copy of the slide deck. The slide deck is actually available in the handout section of the GoToMeeting platform right now. You can download that if you want to follow along. Also, GoToWebinar in general. Due to the number of people using virtual platforms these days, products and companies like GoToMeeting and GoToWebinar, they're having trouble scaling up. You may see some lag today. You may hear some echoing. It may take a moment for the slides to actually change once I move them along. I can actually see right now I've had this slide up for about a minute and a half, and still about 15% of you haven't seen the slide move yet. It's just a product of the technology. There's nothing I can do about it. But like I said, you will get a copy of this program later today if it's just too much and you can't follow along live. All right, so having said that, I'm going to introduce our panel. We have Will Kim, an attorney with Littler. Maureen Marfell, she's a colleague of mine with 501c Services. She's the head of our HR services program. And the superstar in the program today would be Ms. Nicole Korn. She's with Equifax Workforce Solutions, and she's a client relations manager over there with them. So, having said my spiel, I'm going to go ahead and hand this off to Will, and he's going to start with some legal updates for everybody. Don't forget to unmute yourself, Will. There you go.
Hi, everyone. Nice to meet you. Yeah, I'm Will Kim. I'm an attorney at Littler, as Max said. Just by background, I'm primarily a litigator, and I handle a lot of discrimination, wage and hour issues, and a lot of class action work. But as you can imagine, just a few weeks ago, while there were just a low number of infections and this started to become a huge public health crisis, our firm has created a dedicated COVID-19 task force. And I'm a part of that task force. And the last 2 weeks, as you can imagine, has been inundated with a lot of questions from employers just like yourselves. And so we've received a lot of questions. And for the purposes of this webinar, I'll be addressing sort of two main topics. The first is sort of the wage and hour issues. And the second is the leave and accommodations issues. I know this is a tough time, not just for employers, but particularly nonprofit employers. And I'm hoping that this would provide a good framework and some guidance on how to weather through this crisis and kind of spot the areas which may generate a lot of legal risk. So on the wage and hour piece, I just want to especially, let me back up a little bit. A few weeks ago, we with a lot of the world, things have evolved. So just a quick disclaimer that some of the advice that we're giving is very fluid and can be changing. What I say today might be changed, or new guidance or regulations could be provided by the Department of Labor. So I just want to provide that quick caveat. So and now that there's been a lot of closures and shelter-in-place orders, there are big concerns about layoffs and furloughs, and employers are wondering how to walk through those issues. So I want to start with WARN. This is the Federal Worker Adjustment Retraining Notification Act. Generally speaking, this applies to employers with 100 or more full-time workers. And the requirement is that if you have a planned closing or a mass layoff, you have to provide 60 days of written notice. So for your larger nonprofits out there, if you have 100 or more full-time workers, this obligation applies to you. And it applies if there's 50 employment losses at a single site. There is a defense to the 60 days notice, and that's called an unforeseeable business circumstances defense, and in which you would rely on saying we couldn't possibly have foreseen this, and so we weren't able to give the 60 days written notice. It is unclear at this point as to whether COVID-19, despite how much havoc it has wreaked upon the economy and employers, whether this is even a verifiable defense, but it exists, and it's something to consider as you think about your WARN Act issues. And this obligation is triggered if you have layoffs expected to last longer than 6 months. So if you have only a temporary layoff, this obligation is not necessarily triggered. Just be aware, though, that each state has its own possible mini WARN. And so, for example, if you are a nonprofit based in California, there are certain obligations in addition to your federal warrant obligations. So if you do have, if you operate in states in which there is a mini warrant, I suggest you contact legal counsel to kind of walk through what your obligations are. Next topic here, and my colleagues on the panel will address this more in depth, but I just want to address the new CARES Act. This is the Coronavirus Aid, Relief, and Economic Security Act. There are provisions for small loans that nonprofits can obtain from the government, and those loans, there's what's called a payment protection program, and it's meant to cover payroll. So as Dr. Luke had referred to, this is supposed to help you cover some of your payroll expenses and obtain these loans so that you're able to keep your employees employed. One of the big pieces of this CARES Act is the unemployment provision. And what it does is that the federal government enters into agreements with each state. If they do, the unemployment period extends from normally what is 26 weeks per state. It varies obviously, but it extends to 39 weeks. And you can, and employees, if they are become unemployed, either totally or partially, they can receive up to 39 weeks until the end of the year. Note that the CARES Act does not apply to those who can telework. So if you are a nonprofit employer, you have folks working at home, that wouldn't constitute unemployment. In addition, up until July 31st, 2020, for those agreement states, each unemployed individual, whether totally or partially, can receive an additional $600 per week. A quick note on this: there is a concern if you do have employees who are making minimum wage. There are concerns about whether an employee would just decide to quit and prefer to take the $600 per week, or and this is the concern comes from the fact that the CARES Act is very broad. In fact, one of the basis for you becoming employed and you becoming eligible is that you, quote unquote, quit directly as a result of COVID-19. So there is a concern that if an employee, one of your employees, decides to say, I'm quitting because I'm afraid to go back to work due to COVID-19, there is that concern that they would just quit for the purposes of collecting this additional $600 per week unemployment. Now, not every state, this is just beginning, so we're walking through these issues as we speak, but that's something to consider as you decide whether to lay off a portion of your workforce or reduce your workforce's hours or now that we have various shelter quarters of the U.S. is now under these orders. We understand that a lot of employers are now switching to telecommuting arrangements and telecommuting workforces. So that includes my own law firm. I'm here in my room, in my home, just talking away into my computer at home. And so I want to quickly go over what sort of issues you need to think about. Generally speaking, for your non-exempt staff and employees, and subject, of course, to your various states' reporting time or predictive scheduling laws, also your state and local paid sick leave laws. With all those caveats, you can send your non-exempt employee home without pay, and you don't have to pay them so long as they perform no compensable work from home. So you have to be very careful that they aren't, for example, checking their emails or able to log on, because that sort of work can be compensable and you can be liable for not paying them for that time worked. So that's why we say if you're going to send non-exempt employees home and not pay them, make sure they're doing absolutely no work at all. Now there is some provisions with on-call as well. Under the FLSA, the Federal Labor Standards Act, there may be waiting time or on-call time. So under the FLSA, if they remain on the employer's premises and are not able to use their time for their own purposes, they are entitled to on-call time. So if you have, for example, a receptionist who's working at home and just probably not doing much, but is still logging on and just kind of monitoring all phones that are being routed to his or her computer or phone, then that would be technically compensable. So just be aware of these type of pay issues. A big one here is business expenses as a result of telecommuting. If you are now in a remote or partially remote situation, you should make sure to furnish and or reimburse your employees for the tools necessary to work remotely. And that might mean, for example, right now I'm using a laptop with and that's able to use video meetings. That might mean a monitor, docking station, obviously internet access. We need to use that to do our work. There might be ergonomic work space tools that you might need, headphones, things of that nature. Now, federal law might not require a specific item by item reimbursement. So, you know, it doesn't say, hey, we need you to mark down every single mouse and keyboard that you've used and we will reimburse you accordingly. But to the extent that you have sort of on the cusp lower wage earning employees, you will have to reimburse them to the extent that the costs associated with using that equipment for their work makes them dip below minimum wage. So make sure to be careful that if you are requiring your employees to use certain items or pay out of pocket, that that if they are on the kind of lower wage end, to make sure that you have some reimbursement policy in place. In addition, I come from Seattle, Washington, and we have very strict laws on business expenses. So please consult your local, state, and the jurisdictions to determine whether you need to provide reimbursements for business expenses. Next topic here, the leave and accommodation. So this has become also a huge deal, especially in the paid sick and safe time world. So let's start with kind of big thing that happened just yesterday, the Families First. Oh, sorry about that. I lost connection. I think we left off at Families First Coronavirus Response Act, and so I'll just go on from there. Matt, can you hear me just to make sure?
Yeah, you're good. Just start with the Families First Response Act. You'll be good.
Apologies for that. And that sort of goes to how telecommuting arrangements have been very difficult for a lot of us. It has kind of strained platforms such as GoToWebinar and Zoom and what have you. In any event, the Families First Coronavirus Response Act, it applies to businesses with less than 500 employees. The question of how many, if you're on that threshold, we need to walk it through. I can't tell you exactly. The DOL just posted some FAQs on who counts in that in determining whether you're less than 500 or not. But essentially, you do have to count employees who are on leave. You do have to count temporary employees who are jointly employed by you and another employer. So if you have some sort of joint nonprofit relationship, that employee still counts for the purposes of determining whether you are less than 500 or not. But this is a complicated question, and we've actually, Littler works a lot with the Department of Labor and trying to formulate some clarity on how to exactly make that employee count. So stay tuned, and we're DOL is constantly monitoring these, and they're going to be putting out more concrete regulations regarding this. Generally speaking, this is for you smaller nonprofits out there. If you have 50 or less employees, you don't have to, that may not you can claim a small business exemption. So if you have, and that's the standard there, is that it jeopardizes the viability of your business as a going concern. So if the paid sick leave and the paid family leave portions are too onerous for your business, you can apply for an exemption and not have to provide this. So there are two components. One is emergency paid sick leave. It's essentially up to 2 weeks or up to 80 hours of paid sick leave at the employee's regular rate of pay. And essentially, an employee gets the sick leave if he or she is unable to work because the employee is quarantined, based on government directive order or a medical provider, and or this employee is experiencing COVID-19 symptoms and requiring a medical diagnosis. Remember that prior to this, there was no federal paid sick leave provisions, and so this is just kind of a interim measure to address this crisis and to provide a 2 weeks paid sick leave for these very specific circumstances. You can also get paid sick leave to care for an individual, so like your child or your parent who is also subject to quarantine based on a federal or state or local government order, or based on the advice of a healthcare provider. So that's the emergency paid sick leave portion. The other portion is the paid family medical leave portion, and I'm going to call that FMLA plus. And again, this is for a very discrete purpose. And also the employee must have been employed by you at least 30 days to be eligible for this FMLA plus. But you are that employee who is eligible, and the eligibility is really if you have a need to take leave to care for your child whose school or child care provider is closed or unavailable for reasons related to COVID-19. So that's an addition. That's a 10 weeks of paid family FMLA plus, and that is paid at 2/3 the employee's regular rate of pay. So that's the FFCRA. There are those guidelines are being and guidelines and regulations are being written up as we speak. So, but for the most part, that's really what you're faced with and what employees are entitled to. I kind of want to go back with the Americans with Disabilities Act. So, each state probably has a anti-disability discrimination provisions. I'm going to talk about the ADA. Just so you know, for those employees with COVID-19 and have experienced kind of mild or no symptoms or temporary symptoms, under the ADA, that is a temporary non-chronic impairment. So that is not viewed as a disability. But if an employee who contracts it may be entitled to a accommodation, a reasonable accommodation under the ADA, if if the employee's reaction to COVID-19 is severe, or if it complicates one of their underlying health conditions or disabilities. So keep that in mind when you are engaging in the interactive process with your employees who contract COVID-19. Again, if it's just mild or temporary symptoms, probably not considered a disability, but if it does exacerbate an underlying condition, definitely likely a disability. So be careful about those type of things. Another question that we've been really faced with a lot is to consider the fitness for duty or return to work certifications. That is, if somebody has been directed to be quarantined by a treating medical provider or a public health official, then you should make sure that certification is narrowly tailored to seek information that is consistent with the business necessity. So making sure that you're not that employee, that certification is only requesting information to determine whether they are a direct threat to your workplace. So have positive cases in your workplace, make sure, and you want to make sure they get a return to work or fitness for duty, and make sure that certification is very narrowly tailored. And finally, consider your respective paid sick leave laws. There are various sick leave laws that may have may have broad uses related to COVID-19. For example, we just heard from the Rhode Island Department of Labor and Training that fear of having COVID-19 is a basis for either taking leave or is a basis for even collecting unemployment. So just so you know, many of these sick leave jurisdictions may cover certain things that might not necessarily be covered under an ADA analysis. Okay, with that, I turn it over to my next panelist.
All right, Maureen, you're next. I know Maureen was taking notes while Will was speaking.
Right. I was interested what he said about Rhode Island, because before Rhode Island, our understanding was that fear wasn't a reason to be able to take a leave. So that was very interesting to find out. Okay, I want to give a good resource right now. I know Sonia has given this out in her webinars, and we found out about the National Council of Nonprofits, which I know all of you probably know about, or most of you, and they're willing to help out, talk about the CARES Act and other ways that nonprofits can utilize new federal laws and to, get the tax breaks or to deal with care. And it's called the National Council of Nonprofits, and they have a great quarterly newsletter also where they talk about this, and that's the NPQ, the Nonprofit Quarterly. So I just wanted to share that with all of you. I also have an update that just came from the DOL about finally they're talking about how employees need to give you notice to their employers that they need to take leave and need to provide documentation. I'm sure we would all agree that documentation is very important to support paid sick leaves and emergency leaves. And so you can get that information now. The Department of Labor has promised, kind of slow, that they will have those forms out on their site that you can use for your documentation purposes. Right now, what they're saying is you can ask the employee to provide a signed statement containing their name, the date for which the leave is requested, and the coronavirus qualifying reason for the leave, and a statement that the employee can't work or telework because of this reason. So I wanted to share that with all of you. It's kind of come hot off the press. Like we all realize today, everything is fluid and changes by the moment. I certainly know that in talking to all of our nonprofits and being careful because we know things change. But I did want to share that with you today. I think that's very important. I have gotten this question. The DOL also says now that an individual requesting expanded family and medical leave must provide the name of the child being cared for, the name of the school, place of care or child care provider that closed or became unavailable due to the coronavirus, and a statement representing that no other suitable person is available to care for the child during the period of this requested leave. Also, if an employee fails to give proper notice, the employer should give him or her, of course, with this under these circumstances, notice of the failure. You can do that, but give the opportunity to them to provide the required documentation before denying any leave. So you do need to be careful with that. And more guidance, as we keep on hearing, will be forthcoming. And they're supposed to put some new forms out there for all of you to use to have the employee have a form to fill out. I did want to share that. I have gotten questions in that area. Also, I have a good website with the DOL. If you have your pins there, or if you want it later on, please let us know. But you can go to https://ffcra.idealscale. That's IDEASCALE.com. And that you can get those forms, but you probably won't see them until mid-April, I'm guessing. So I just wanted to share all of that with you. Will did go through, the other things that you need to know about FFCRA. And I also want to talk about another good source is your EOC. They've just updated their site, the United States Equal Employment Opportunity Commission, about what you should know about the ADA and the Rehabilitation Act and COVID-19. And they provide, did I lose you guys? Did I lose you?
No, I'm still here. Did I advance the slide too soon? I'm sorry.
Oh, that's okay. Am I okay, though? You can hear me.
Absolutely. Yes, ma'am.
Okay, sorry about that. Another thing that I want to talk about right now is the EOC guidance. Will already talked about some things regarding ADA and the Rehab Act. And I do have something I want to share for you. It's about how much information an employer can request from an employee who calls in sick in order to protect the rest of the workforce during the COVID pandemic. And so this is what they say to the EOC. They said, during a pandemic, ADA-covered employers may ask such employees if they're experiencing symptoms of the pandemic virus. For COVID-19, these include, as we have all heard, symptoms such as fever, chills, cough, shortness of breath, or sore throat. Employers must maintain all information about these employees' illnesses, of course, in a confidential medical record in compliance with the ADA. I don't think most of you should do this, but if you work in a healthcare type organization, or a rest home or a hospice, I know this would be important. And the ADA now says that you can generally measure an employee's body temperature and have a medical exam and take that temperature. Certainly you have to be careful with all of that, and I would only say this would be for those types of nonprofits that deal with medical care and a hospice. And does the ADA allow employers to require employees to stay home if they have symptoms of COVID? And now they do say yes. And the CDC states that employees who become ill with symptoms of COVID should leave the workplace. The ADA does not interfere with the employers following that advice. So those are just a few things I wanted to share with you in relationship to ADA, the Americans with Disabilities Act. Go to the EEOC site. It's a great site, and they have a lot of information on COVID right now. And then I wanted to go to benefits, healthcare benefits. I'm being very careful with this, but we are starting to get those questions. What am I going to do if the healthcare benefits run out for my employees? My recommendation to all of you is, and you may have already done this, but go to your broker or your benefits administrator. I have heard that some of those insurance carriers have been extending it more than through the end of a month. Right now, I hear that some have done it through 2 months. I can't guarantee that. You need to go talk to your broker or your benefits administrator to get more information. This is very important. We all know that COBRA is too expensive for employees. I know most of you are trying to keep them on as long as you can, but we know that it's also costly. And you want to make sure that that coverage doesn't stop for your employees. Please talk to your healthcare, your broker, and a benefits administrator. You guys will need to look at what the policies say in that plan and very important to have that information. I also know that some benefits will be stopping, such as if you have an LTD plan or an SDI plan. If you're in some states, like here in California, we have it through our state SDI, that certainly would not stop. But if you have separate plans, do make sure you know what's happening with those plans. And of course, the goal is, I'm hearing, to at least right now, provide those benefits for the next 2 months. Can't guarantee that, but do look into it for yourselves. Also, retirement 401ks, make sure, and many of you are probably doing that, but do make sure you check with your broker. There is so much information coming out right now, and we are trying to help as best we can. And I know Matt will send questions we can't answer today on to us. I'm not going to take any more time now. I wanted to give you an overview of those things we've been talking about and some resources for you. I'm going to pass it on to Nicole now.
Thank you, Maureen. Nicole, before you start, Maureen, while Nicole's talking, you gave out a website. Could you type that into the chat box for everybody? We've got a couple of requests.
You know what's interesting for me now? I don't have that. It's all disappeared, even the slides. I don't know why.
Okay, well, why don't you just email it over to me, and then I'll send it out.
I will.
All righty. You're fine. Nicole, you ready, ma'am?
I am. Thank you. Well, good morning or good afternoon, depending on where you're joining us from. I'm going to try to walk through this as quickly as possible. I do have a lot of information, and what I'd like to do first is just to review some of the general guidelines for how unemployment works, because I think it's really important to just set the foundation so that everybody can then understand how that has changed due to the pandemic and the CARES Act. So I think you got to kind of understand the basics first. So I'll just very quickly go through that. So first of all, who can file for unemployment? I'm getting this question left and right. So I do want to clarify that anyone can file for unemployment at any time for any reason. Eligibility is obviously a separate issue, but anyone, part-time, not exempt, non-exempt, it doesn't matter, they can file. Eligibility, however, is going to be determined using 5 criteria, and that criteria is going to be the same across all states. Now, they might use different computations or, interpretations, but it's the same general 5 criteria. So number 1, in order to be eligible for unemployment, you must be physically able to work. You must be available for work. You need to be actively seeking work. You need to be separated due to no fault of your own, and you must be monetarily eligible. And when we talk about monetary eligibility, the states are looking at both your historical wages and current wages. So first, what they're going to do is when someone files for unemployment, they're going to go back to something called the base period, which is typically first 4 of the last 5 completed quarters. And they're going to look at all employers that paid wages to that individual during that period of time. And that is going to determine if that person has met the threshold, the minimum threshold, to be eligible for unemployment benefits. It's also going to determine which employers are chargeable and for how much. Okay? And then the state is also going to be looking at any current wages. So is this individual currently receiving any type of wages that might disqualify from unemployment? So we'll talk about that here when we talk about partial unemployment, right? So that's one area where current wages might come into play. So maybe you have an individual that is not fully separated or, temporarily fully laid off. Maybe they're just working a reduced schedule. Partial unemployment is available as an avenue of relief, and individuals can file, and basically the way that works is they have to report their wages each week to the state, and then each state has their own calculation, and they basically determine first, what would that person have been eligible to collect had they not been working at all, so if they were totally unemployed. And then they take the wages that they earn each week and they plug both numbers into a calculation, and that determines their partial benefit. None of the states deduct 100% of the wages earned, they offset it. It's usually around 20 to 25% that they offset, but it is different in every state. So what should you tell your employees? I'm getting these questions a lot. And what I really want to stress is that you should not tell your employees that they should or should not file a claim. What you should tell them is they have the right to file a claim. And definitely want to avoid setting any expectations in regards to their eligibility or their potential benefit amount. You must understand that these things vary greatly by person and individual circumstances. So your obligation as an employer is really just to allow them to file, as is their right, and then allow the state to collect the appropriate information and make the determination on their eligibility. You also should tell your employees to be patient. This is coming up a lot right now, and I know everybody's frustrated, but the states are really overwhelmed. Their websites are crashing. They're having a very difficult time meeting the volume and the demand. So I would just say, it will all sort itself out, and I get that. Everybody needs their, income, but please be patient. And also, they should expect some delays, and they should also appeal if necessary. I'm hearing a lot of reports of individuals that are being denied by maybe like a false positive, if you will. So what I want to tell you is that the legislation is changing quicker than the states can implement things and make changes in their systems. And so, an individual who may not be required to search for work because of the COVID crisis, if they choose, say in the state of Washington, they choose that they want to be on standby. If you don't put a return to work date in, which most of us don't have, it's going to deny them, right? Because their systems are not updated. It's flagging that as an issue. So I just want to say that, if your employee gets a denial, they should appeal it because the information is constantly evolving and the circumstances may have changed. Next slide, Max. So let's talk about, on these general guidelines that I've provided, let's talk about how the pandemic and the CARES Act have impacted these guidelines. So first of all, let's talk about eligibility. So earlier I mentioned you have to be available for work, able to work, seeking work, all of that. The CARES Act has really expanded eligibility requirements and is allowing individuals who would not have normally qualified under those provisions to now qualify. One of the biggest ones is availability issues, okay? So if you are choosing to, say, self-quarantine, previously you would have been making yourself unavailable for work and would not have been eligible to collect. But the CARES Act is allowing for flexibility on those availability issues, depending on the circumstances. They're also allowing individuals who maybe weren't monetarily eligible before. So maybe you're an independent contractor, so you don't have wages reported by your employer, or maybe you're self-employed. So those types of individuals may now be eligible to collect as a result of the CARES Act. And again, the states, we've talked to them, they're not quite prepared yet for this. So if you have individuals that maybe are a part-time employee, they don't work very often, maybe they wouldn't have met the eligibility requirements monetarily, the guidance is to wait and try again later, or wait to file the claim in general, to give the states a minute to catch up and adjust those requirements. The other big one is the benefit amount. The benefit amounts obviously vary by state, but what the CARES Act has called for is to add a flat $600 across the board to everyone's benefit amount. Now, that is federally funded, which is good news for employers, but the language is very ambiguous. And so we don't know if this applies to, say, individuals who are collecting partial unemployment. If they're working some hours and just collecting a partial, do they get the $600? We don't know the answer to that question, unfortunately. It is not spelled out in the Act itself. We did speak with the state of Michigan, and they too said they don't know the answer to that question. And so I think the states are waiting on guidance from the Federal Department of Labor. So just know that this, is an ever-evolving situation. The states have said that once they finally are able to implement these changes, it will be retroactive. So they, individuals who were qualified as of the date will get the back payments. But again, we just don't know if individuals that are collecting partial unemployment will be eligible for the $600 or not. Another thing that has changed is chargeability. So this issue is still a little bit somewhat unknown. We don't have 100% guidance, at least for certain states. So what I want to say on this is that some states have already issued guidance on whether or not an employer will be charged for COVID-related unemployment claims. So I do recommend checking your individual state's website to see if your particular state has a position on this or has communicated on this issue yet. There's only about maybe 5 or 6 that I know of that have specifically called out relief for employers. But, don't panic, because if you're not on that list and your state hasn't issued any specific guidelines as far as relief, you may still be eligible for some relief from the federal government. Okay, so some states were ahead of the federal government. They did their own thing in regards to waiving charges. But the federal government in the CARES Act specifically states that they will reimburse the states up to 50% of the charges related to COVID claims in the effort to reimburse nonprofit organizations. They didn't specifically mention merit-rated or tax-paying employers, but we do expect additional information or guidance to still be forthcoming on that. And I really want to stress, okay, we do not know at this point how the states are going to track these charges, determine the reimbursement. We don't know the timing of the reimbursement. So please know that. The states don't know either. So they need time. They've got to catch up, right? The federal government has put all of these new provisions in place. Now the states have to scramble to figure out, okay, how are we going to implement all of these new provisions, and how is this going to work out? And so what I just, don't stress, and it will all work itself out. The states are well aware of what claims are related to COVID. If you use a third-party administrator such as Equifax, we are coding those claims that are related to COVID. So we will be able to track and monitor those charges, and know that, there are caveats to that rule, right? The states, as the attorney mentioned earlier, the states do have to enter an agreement with the federal government to get the funds. And so I wouldn't consider anything to be a guarantee at this point. We do expect that nonprofits will get that 50% if they're not in a state that is already giving them relief. But again, I just want to stress disclaimer, we don't have concrete information on how that will work at this point. Duration. So the Act also extends benefit duration, and you heard a little bit about that earlier. They're extending it an additional 13 weeks. Again, that additional 13 weeks is federally funded, which is good news. Most states, on average, pay out a 26-week max. It does vary by state. Some states only pay out 13 weeks already. Some states, it depends on the unemployment rate, and it's tiered by that. So what I would say is, look at your individual state and what the maximum week guideline is, and you can add 13 weeks to that, and that would tell you what the maximum amount of time is that someone could collect. And lastly, the CARE Act does call for flexibility on late payments. So for you reimbursing employers that do pay dollar for dollar for unemployment claims, there will be provisions for extending payment deadlines and or waiving penalties and interest on late payments. They'll allow payment plans and things of that nature. So, in addition to the other relief that you might be getting in terms of charges, know that if you still have a significant amount of charges that, you have difficulty paying immediately, there will be some flexibility on that under these guidelines. Okay, next slide. Okay, so let's talk about cost options and how to calculate costs. This is a question that I'm receiving very frequently, and everybody wants to know, right? What is my maximum exposure? How can I calculate the potential liability associated with these claims? And the short answer is you really can't. You really can't. There's too many variables, and there's just not enough information. You heard me say earlier that the way they calculate eligibility and how much someone can collect is by looking at wages paid by all employers in the base period. And so unless you know for sure that you're the only employer that has paid them wages for the last 18 months or so, you're not going to be able to calculate that person's benefit amount. In addition to that, if they've had wages for multiple employers, you're not going to know what percentage of the wages you paid and therefore what your percentage of the charge is. Now, some states have other charging provisions, but in general, most states charge proportionately, meaning if you paid 30% of that person's wages during the base period, you're going to be responsible for 30% of whatever their weekly benefit amount is. So I do want to say that for you nonprofit employers, you could also be receiving benefit charges for individuals that left your company months ago and maybe got laid off from a subsequent employer. So again, there's just so many factors that it's just really hard to calculate. In addition to that, if you've got individuals working partial hours and they're claiming partial benefits, it would be very difficult to keep up on a weekly basis, what that partial benefit's going to be that day. So I think you can use general guidelines if you're really trying to figure it out. You could maybe take the state average or maybe just take your average, payroll and try to come up with some numbers, but it's not going to be a clear estimate for these reasons. A lot of questions we're getting to is, about paid time off, PTO, sick time, those sorts of things. And what I want to say is that it varies by state, but most states will deduct those types of payments from unemployment. So rest easy. If you're worried that your employee has filed for unemployment, but maybe now is receiving some sort of additional payments, that employee is required by law legally to report any wages that they are earning while they are claiming benefits. And so we know that a lot of these changes have come maybe after people have filed for unemployment. So don't worry, the states will calculate that in. It does need to be reported, and they will adjust it accordingly. Now, there are a few states that, don't necessarily count certain paid time off as wages. So the best thing that you can do is, if asked, provide the information and allow the states to make the determination on whether those payments are disqualifying or not. And then lastly on this issue is, I'm getting a lot of questions on if I continue to provide benefits to my employees, will that impact their unemployment? No. Special payments like PTO and sick time, yes, those could impact unemployment, but benefits such as healthcare does not come into play when it comes to unemployment benefits. They don't even ask about them. Next topic. Okay, so lastly, what I want to cover really quickly is there are a lot of state-by-state specific regulations as it relates to unemployment. So you really want to use your state's website as a resource guide for this type of thing. Okay, so we talked about duration, how long someone can collect. It varies by state. So you will want to check your specific state to determine that information. Minimum and maximum weekly benefit amounts, again, varies greatly by state. In Missouri, the maximum you can collect is $320 a week. And in Massachusetts, it's something like $1,200 or something to that effect. So big swings across the board. So please check your specific state. And then also work share is a big question that we're getting. And what I want to stress on work share is that work share is a state administered program. It is handled directly between the employer and the state. So if you're using a third party administrator such as Equifax, we're not involved in that process. The 501c agency's trust would not be involved in that process. So we don't provide a lot of guidance on those programs because we don't work with those programs directly. So what you would want to do is reach out to your individual state's website to get the FAQs and the filing and application requirements. I do want to say that just, so you don't have to use a work share program. So you can, but the idea behind WorkShare is to help waive, work search requirements during temporary layoffs. It's also to ease some of the burden on the employees for reporting wages each week. I feel like these applications take 30 days. In normal times, they can take up to 30 days. So you could see delays on that at this point. So if you were hoping to use the WorkShare program, but you're not able to, individuals can file individual benefits and still get benefits the same way they would with WorkShare. So rest easy on that issue as well. And the last thing I want to talk about is we've gotten questions on, is there a way I can mass file my claims for my employees? Can I just send maybe a file to the state or do some sort of bulk upload? Again, these vary by state. Okay, so there's a few states that I know have provisions on this. I know we're nearing the end of time, so check your individual state sites. Like Georgia, they're requiring for employers to report partial claims through their site. Alabama is also wanting employers to do that. So in some states you'll have the option, and in some states you won't. So again, just a very state by state specific provision. So I think that's all I had to cover today, Mac, and I know we probably don't have time for questions, but I'm available if we want to do any questions.
Perfect. Yeah, we're short on time, but I do have two questions that I'm going to, because I see in the questions box a lot of the same questions, so I'm going to pick one or two for you guys to go over. But before I do that, 501c, we also have a COVID-19 frequently asked questions page. I can tell you that I update it a couple of times a day, and Nicole and Maureen are two of the people who help us keep that updated. So if you want a place to go every morning while you're drinking your coffee, this is one of them. We'll try to keep it updated for everybody. So real quick, so everybody can go to lunch or get on another conference call. There's a couple of continuously asked questions. This one would be probably for Will. The law, like the FFCRA, talks about stay-at-home orders. But we're seeing states issue different language, like they have a state of quarantine or an isolation order. Can you help us with clarification as to what is going to happen when the federal government calls a quarantine one thing, but the governor of their state declared something completely different, but they both result in everybody staying home? How that's going to be handled, if we know?
That's a very good question, and in fact, that's exactly the type of question that we're posing to the DOL, Littler's Workplace Policy Institute. So I hate to say this, but the answer is we don't know, and this is one of those areas where we are in constant contact with the DOL to gain clarity on this. Trust me, we check the DOL FAQ section on these type of questions. We're waiting on regulations. We're waiting on guidance in writing. But I will say that what will likely be the situation is, the federal government trumps the states. So whatever the federal stay-at-home order, if there is going to be one, we don't know. I don't know. We'll probably guide more so over than any specific state shelter-in-place order. But again, the FFCRA is for 6 discrete sort of buckets of leave, and so when you're looking at the FFCRA, it really just relates to whether you're directed to be under quarantine, and we're not even quite sure if it's shelter-in-place orders. Because it only applies to those. Well, because if you're teleworking, you're teleworking. So you don't need to take the leave per se. But it really applies to I have COVID-19 or my family member has COVID-19 and I'm directed to be under quarantine and unable to work. So that is sort of the general test that you need to figure out. The shelter-in-place orders are to be determined, and something that if you go to littler.com/coronavirus, we may have updates later on, and we'll provide you what we find out from the DOL.
Okay, great. Yeah, and that's just a clear example that everything is so completely fluid, and new law is just being created right here in front of our faces. So it's there's not always an answer now. There's an answer maybe later. And then the second question that I'd like us to cover is, I don't know if this is for Nicole or Will wants to cover it, an explanation of the additional $600 in unemployment that is being applied. Is that tacked on to the unemployment check? Is it going to be a separate check? Is it a weekly benefit? How is the $600 working, the additional $600 that everybody keeps hearing about?
Yeah, Max, so this is Nicole. I'll cover that. So in terms of the $600, so that is a tack on to whatever they would normally qualify for, right? So if you normally qualify for $300, our understanding is you're going to get an additional $600 on top of that. In addition to that, they are giving the states the ability to determine if that's going to be paid in the same check as their regular benefits or separately. They don't really know. It will be paid weekly, but they don't know for sure, to what, what method of payment. Like, is it it's going to come from the same source, the state, but they just don't know if it's going to come together or separate at this point. I think it's up to the individual state to determine that.
All right, well, we're about 10 minutes over. We have everybody's questions. I'll forward them to the appropriate parties. They will, of course, they have other jobs, but they will, of course, do their best to answer what they can in a timely manner. It's very fluid. I'm sorry that we can't give everybody concrete answers to everything, but we are here. You all have my email address if you think I can help you with anything technically about today, about the program itself, or additional services or issues related to COVID-19. I'm here all day long as well. So, panel, I really appreciate you taking time of your busy days for me, and I look forward to seeing everybody again at some kind of mixer later on one day, eventually.
Okay.
All right.
All right. Thank you. Thank you. Bye-bye, everybody. Good luck.